So let's break something down that I wish more people understood. I'm Tiffany, I'm a physician assistant, but I'm also a GLP-1 advocate. So I help people get access to medication that can't get it through traditional insurance. So if that's something that you're struggling with, there are links over here in my bio that hopefully can get you help getting access to the medicines that you need. So the medications that are over the counter that you reach for on a routine basis for everyday pain can take serious effect on your kidneys. And more people need to realize that this can affect them very seriously. So NSAIDs, non-steroidal anti-inflammatory drugs. These are over-the-counter medications and they come in many forms. So Ibuprofen, which are the brand names Motrin or Advil, Naproxen, which would be the brand name Believe, or we've even got some of the prescription names, which would be Meloxicam or Mobic, or diclofenac, which is Voltaren. These are all examples of NSAIDs. They are awesome for inflammation and joint pain, but they also do something in your body and they block prostaglandins. Now, these are a hormone-like chemical in your body that help the kidneys get blood flow. So the problem with that is when you block prostaglandins, especially in people who have diabetes, have high blood pressure, this leads to decreased perfusion or decreased blood flow to the kidneys. Over time, this actually leads to chronic kidney disease. So the people that are at the most risk of developing chronic kidney disease are people over the age of 60, people that take diuretics or ACE inhibitors for blood pressure, people who stay dehydrated because they are not good about drinking enough fluids, or people who have diabetes or are on a GLP-1. So what about Tylenol? So Tylenol, or generic name is acetaminophen, does not block the blood flow to your kidneys. So it's generally considered a safer option. But it is metabolized in your liver. So there are different concerns for Tylenol. So in general, the maximum daily dose of Tylenol or acetaminophen is 3,000 milligrams a day. And you should never exceed 4,000 milligrams a day for any reason because it can be extremely toxic to your liver. So a lot of cold and flu medications contain hidden acetaminophen, so you have to be careful about reading your labels. So taking multiple products can actually push you over the safe limit of Tylenol without even realizing it. So what's the safest plan? Well, in general, we consider Tylenol or acetaminophen the safest first-line drug for general aches and pains, especially if you have any concerns with your kidney or are in one of the high-risk groups I talked about. If NSAIDs are necessary, we always want to use them at the lowest effective dose and for very short periods of time. And then you always want to make sure that you hydrate really well with them and never take them on an empty stomach. Just remember that your kidneys filter over 50 gallons of blood a day, so we don't want to do anything to make the job harder on the kidneys. So pain relief should not come at a cost to your long-term kidney health. So please discuss this with your primary care provider if you're unsure what medicine would be safe for you to take. But please don't just blindly reach for stuff over the counter if you don't know how it's going to affect you long-term. And just remember that just because something's over the counter does not mean it is safe for you to take. Protecting your kidney health is so important because we need our kidneys to last a long time so that they can protect your health later. So if you like this video or you like this content, please follow me for more and reshare for everybody so that more of your friends can find out more about what they need to know.